Hello, we're here for our weekly update on the COVID-19 crisis here in Nashua and everything that our entire community is doing to fight this virus. Now, I started with my mask because it is important to wear masks as we're around the city, around the community, and we'll be talking more about that later. So I won't wear the mask while I'm actually speaking directly with you, but otherwise I definitely will be wearing the mask. The city has been working hard on the COVID-19 crisis for a long time. And you're going to hear from Bobby Bagley, Director of Public Health and Community Services, regarding many of the things that public health is advocating. You're going to hear from the police department regarding the wearing of masks and the enforcement of an ordinance that I will mention in a minute, and which Bobby Bagley will discuss in more detail. But overall, we know that this is hard for everyone. It's been difficult to be at home and not being able to socialize with our friends, the whole physical distancing, physical separation that's so important to containing the spread of the virus. But as you will see, we are making progress. We're trying to balance a couple of big objectives. Number one, safety, especially for our senior citizens. And as I've talked to our senior citizens in the community, they are very aware that they particularly are vulnerable to COVID-19 and the serious effects that they could suffer were they to contract the virus. So we're trying to make sure that everyone in the community is safe. And of course, we're keeping in mind that some people who get the COVID-19 virus don't have any symptoms and don't even know that they are infected. They, in turn, can affect other people. And this is how these big outbreaks, like we've seen in New York, in New Jersey, Boston, it's how these things get started. So we're trying to maintain the balance between safety and trying to reopen our city, our economy, because we know that many people are hurting as a result of the economic effects of what has occurred so far. Right here in Nashua, we estimate that more than 10,000 people, including those who work in Massachusetts, have filed for unemployment, meaning they are out of work. So those families are hurting. They are getting a supplement from the federal government for the time being, but that is temporary. And we need to always keep them in mind, keep you in mind as we think about how to move forward. We also have a small business community that is also hurting. Many small businesses, restaurants, and small stores have been closed for more than a couple of months. And people rely on that, both the employees and the owners rely on that income to support themselves and their families. We know that the jobs that small business creates and maintains is a very, very, and probably the most important support for the country's and our city's overall economy. So as we move forward, we are going to exercise the desire that you wear masks and that we continue the social distancing. Of course, we're working under the supervision of and at the direction of the state of New Hampshire, which has ultimate authority here. But we're also working to try to open our businesses downtown, especially, and throughout the city, and you'll hear we'll get into a little more of that later. But right now, I wanted to give you an update regarding the cases that we have here in Nashua and what we think is the progress that has been made so far. And we have various slides. This just shows you the case update, the number of cases nationally, globally, the New Hampshire cases. So far as of this morning, there have been 4,231 cases here in New Hampshire. About 211 people have died. Hillsborough County has 2,000 cases. Here in Hillsborough County, which of course is where Nashua is located, there have been over 100 unfortunate deaths. Now this gives you a sense of the Nashua cases. Right as of this morning, Public Health has documented 389 cases right here in the city. That is more than we want, but it is far less than what we've seen in some neighboring cities like Manchester, Lowell, and Lawrence. Right now, most of those 389 people have recovered, but we count 74 active cases. In other words, people who have COVID-19, have been tested positive, but haven't yet recovered. We unfortunately have had 12 people die here in Nashua as a result of COVID-19, and of course that is what we're trying to prevent. People who get the disease and suffer symptoms so serious that they end up succumbing to this dangerous virus. In Nashua, 81% of the people have recovered, and about 12% of the people who get the virus end up in the hospitals. Now, so far our hospitals have not been overcrowded because we've been able to keep the number of cases down. This morning there are around 15 cases of people with COVID-19 in our 2 hospitals. That number has gone up as high as around 20, varies a little bit, but somewhere between 10 and 15 has been the most true on most recent days. Now this shows you the new cases per day in Nashua. So certainly there's testing going on all the time. Public health has been testing people, but there's various private testing going on in the care centers and the like. Through working with the state, we know how many positive cases are identified each day. Now Nashua is not a huge sample, so there's a little bit of up and down to it. But you can see that in the month of May, the trend is downward in terms of the number of new cases. That's what we're looking for. We want to see the number of cases continue to decline. We want to see the number of hospitalizations decline so that we can gradually, corresponding with that progress, begin to open the economy, allow the businesses to step by step function more normally. The next slide gives you the number of people that have been tested in New Hampshire on the left with the colored lines. Number keeps rising. Almost 70,000 people have been tested here in New Hampshire already. We want those tests to continue. It's very important to continue to test as many people as we possibly can, because in the end we risk a second outbreak as the economy opens. We know that, but we don't know for sure about this virus. If we listen to the medical experts, oftentimes these coronaviruses, and this is one of a family of viruses, often these coronaviruses subside to a great degree in the warm months like we have now, May, June, July, August, but then can reemerge in colder weather, in the fall, when the days are shorter, there's less sunlight, and there's less heat, less temperature. That's how other coronaviruses act. And in addition, if that phenomenon occurs while the state has reopened its economy, so there's more interaction, more personal contact between people, the risk of a second outbreak certainly is there. But we don't know, and neither do the medical experts, but we want to exercise caution. And one way to do that is to continue to test a lot of people to determine, so we can get an early indication if the number of cases is beginning to rise, if there's a early reemergence of the COVID-19 virus. On the right shows you the number of people that are being monitored by our public health department here in Nashua. These are people who have been identified as having been in contact with a patient who has the COVID-19 virus. And so our public health nurses interview each patient, over the phone of course, and they identify who did you have contact with in the days before you got your symptoms, before you became symptomatic. And all those people public health talks to, and instructs them to quarantine themselves for 14 days. So if they contracted the virus, they won't spread it to someone else. And of course, we would like those contacts to be tested so that we can determine did they contract the virus or not. The next slide is the percent positive. This has to do with the total number of tests and the percent positive that come out positive, in other words, turn out to have COVID-19, and this is a New Hampshire figure. So you can see that as of now, as of late in June, we've got about 7% of the people tested are turning up positive. In other words, they have the COVID-19 virus. But the trend there is also good because it was over 10% a month or so ago and has trended down now to about 7%. That's good news. Again, it shows that the virus may be subsiding, and therefore we are justified in opening the economy to some degree, again, step by step in concert with trying to keep people safe as we do that. Now, for those who believe they should be tested, and particularly if you're symptomatic or if you're in a high-risk category, someone who lives in a congregate care facility or a nursing home, or someone who may be over 60 or has had exposure to someone with COVID-19, there are available clinics run by public health where you can get tested. The next one coming up is tomorrow, May 28th, from 3 to 6 p.m. Now, in order to prevent a lot of people from congregating at the same time, you need to schedule an appointment. But our COVID-19 hotline, which is 589-3456, is the number you should call to get an appointment to get tested tomorrow and on subsequent days if tomorrow is not particularly good for you. We wanted to talk, and Director Bagley is going to get into this a little bit more, and I'm going to ask her to come up soon. We're going to talk about the effectiveness of the masks in preventing and containing the spread of COVID-19. Now, in the beginning, and some people are still focused on this early research, in the beginning, the researchers thought that COVID-19 was mostly spread by large droplets that are emitted when people cough or sneeze, that those droplets fell to the ground. And initially, our experts thought, well, masking people won't really help because those droplets will fall to the ground quickly and no one will catch the virus that way, or very few people, and the mask won't do much. But as the research has progressed, they have now determined that most transmissions of COVID-19 occur when someone talks, or of course sneezes or coughs, but emits very small particles very small particles, which are so small and so light that they remain suspended in the air, even if the person leaves the area. Maybe you're in a store and you're at a particular in front of the meat counter or something, and you walk away. If that person were infected with the COVID-19 virus, they might have left mist in the air containing the COVID-19 virus, which someone else could contract the disease by just walking into and breathing in some of this unseen but still suspended mist that another person had emitted. So this chart, and the next chart I will show you, talks about the most recent research and suggests that the masks are very important because they prevent a person who, again, has the virus but does not know it from emitting this mist. So it prevents another person from contracting it. And if you're in a store or somewhere else and you're wearing a mask, even if these particles are in the air, it helps prevent you from taking that virus into your system. and therefore protects you from catching something that you're not aware of. This chart concludes, and the bottom line here is that if 60% of people wear masks and those masks are 60% effective, that's enough to control the epidemic, meaning to keep the number of cases down. But of course, we want a higher number than 60% because we not only want to control the epidemic, we want to wipe out the epidemic. So we're looking for a higher percentage of mask wearing than that. Now I am going to turn now going to give you, ask Bobby Bagley to come up. Now Bobby has been doing a great job. She has her mask on. I don't know if she's going to leave it on, but we're going to keep physically distant. She's done a great job in leading the city's effort against coronavirus. She is a PhD. She's been working in public health her entire career, and thank the Lord that we have Bobby here in our community, because she's had a wonderful effect, a very beneficial effect in terms of keeping people safe. So I will ask Bobby to step up here after I step away.
Good afternoon, and thank you, Mayor. And since we are at least 6 feet, we're actually more than 6 feet apart, I will remove my mask, and we'll talk about the importance of wearing the mask and the social distancing and how that has helped us in Nashua flatten the curve of what we've seen with this viral infection in our community. And I will talk about the importance of this ordinance that the Board of Health worked with the Board of Aldermen and was passed by the Board of Aldermen and the Mayor as a very important measure for us to continue to stop the spread of COVID-19 in our community and in our region. And I do have to correct the Mayor. So I don't have my PhD yet. I'm still working on it. So maybe sometime after things go back to me being able to get back to my coursework, the Mayor will be able to say that and it'll ring true to that date. But thank you. So that's encouraging for me, Mayor. I'll get there. So the Board of Aldermen passed an ordinance for face coverings so that we in Nashua can continue, and in our greater Nashua region, so that we can continue to stop the spread of COVID-19. And as the Mayor presented on that previous slide, if we can get over, slide says 60% of individuals wearing the mask, 60% mask effectiveness. If we can get the majority of our population wearing these face masks, washing their hands, not going out when they're sick, and social distancing, we can stop the spread of this infection and the impact that it has on our most vulnerable populations. So what does this ordinance mean for us here? That we would like for people to really take this seriously. And we say that because, you saw the statistic of the percentage of individuals that are affected by this and the folks that die. The mask ordinance is to help slow that down and stop that. This emergency public health order was put into effect that will require the public to wear masks when we're in situations where we cannot maintain that 6 feet or more of social distancing, where we have to come close to each other to do services or when we're executing any businesses. And so the reason for this is also because we've learned that there is asymptomatic spread of this virus, meaning I may not show any signs or symptoms of disease at all. And so by me practicing and wearing this face mask, it's going to reduce any respiratory droplets that may be infected that I don't know about from spreading to someone else. So what does this mean for us? We want employees and we want customers of all businesses to wear their face covering and cover their mouth and their nose whenever they're within 6 feet of each other or less than. And the proper use of this, covering the nose and the mouth. Also, proper use of this is not touching the mask, not touching the face, not touching the eyes at all. Not dropping the mask down below the nose or even below the mouth. So when we talk about the effective use of the face covering, we're talking about covering the nose and covering the mouth. Now, this would include wearing the mask in outdoor areas where business is conducted, as well as work sites and in government buildings. The mayor talked about the mist or walking through someone else's mist. I like to think of it this way. If you could just picture this, we have our little protective bubble, 6 feet around us. When someone else comes in my protective bubble, and that's less than 6 feet from my body, you're in the midst of that spray that I have when I sing, when I cough, if I sneeze, you can walk right through that. This virus likes our mucous membranes, our nose, our eyes, right? And so if it goes into the nose and the mouth, that's how this is transmitted. So we want to make sure that we're wearing our face mask when we're in these settings to stop the spread of our respiratory droplets and someone else coming into contact with that. And the face coverings they can be made of cloth, they can be made of fabric, they can be these surgical masks that are being distributed. And it's a material that, again, blocks those respiratory droplets from escaping from the individual out into the environment. If the face mask has a little side hole where there's a little vent, those allow for respiratory droplets to come out. And so you want to make sure that it's a complete covering that doesn't have that respiratory droplet outlet so that the droplets can escape. When else do we want people to wear the mask? When you're entering a restaurant, when you're going in either to pick up your food, when you're going in to order your food, or for any other purpose, we want people to have the face mask on. If you're going to dine outdoors, when you get there, have your face mask on. We don't expect you to be able to eat through the mask, so you are going to have to remove the mask once you're seated at your table and once you start to eat. But anytime, again, that protective bubble, once it's invaded, you want to make sure that that mask is on. If you're entering into residential or commercial buildings where it's large and there's a common area and there's communal spaces, we want people to have those masks on, again, for that protection. Because we know that children may not be able to wear their mask effectively or efficiently, this ordinance does not require children under 10 years of age to wear a face covering. However, I will say if you can teach your child how to wear the mask appropriately, then you can. I've seen children under 10 wearing their mask appropriately, and then it is safe. But if the child is touching the mask and touching their face and touching their eyes, then you don't want to put the mask on them because it's going to be something that distracts them or draw their attention to that mask. The mask is also not recommended for children under the age of 2, again, because of the safety, because there's strings on it and sometimes it ties, and we just don't want kids to be injured by the strings or the ties. The face covering is also not required if the person has a medical condition that would limit their ability to effectively breathe, or if it's going to inhibit them to be healthy while they have the mask on. And that person will know that they cannot wear a mask. And so for that individual, we're asking for everyone else, again, to have on a mask to reduce their respiratory droplets, and then make sure that there's that 6 feet of distance from that individual who cannot wear a mask because their air droplets will be in the air. Because we've put this ordinance in place, we also want to make sure people have access to face masks and face coverings. And so there are free face coverings that will be distributed every day until May 31st from 10 to 12 p.m. in the afternoon at City Hall, in the plaza, and at Railroad Square. And these are masks that are being distributed through the United Way and some of our donations and other nonprofit organizations that have contributed to this. This mass, M-A-S-S, distribution of masks will be occurring until the 31st of May. So our recommendations, and again, this is going to work if we as a community do this together. Again, we want to have the majority of folks doing this. And yes, this is hard. It's difficult. It is going on for a long time, but Nashua is actually doing really well with this disease. We want to continue to see that curve going down. The mayor showed the data. He showed how we're downtrending. We want to continue to see that downtrend. So our recommendations from public health, from our mayor, who cares deeply about this city and has supported all of these efforts, and this is hard work, from our governor, from the federal level. But here, our public health recommendations are to wear the face coverings. Remember, we can stop the spread of this virus by doing this simple thing. Wash your hands as often as you can. Use the hand sanitizer when you can't get to running soap and water. Running water and using soap. Frequently hand washing, the hand sanitizer, 20 seconds, just as if you were running your hands underwater. You want to do that as well. As much as you can, avoid close contact with people that you don't live with. So when you're out in the public, reduce that time that you're with individuals that are not from your family. Avoid parties and other social gatherings. And yes, the weather is getting nice. We just came off of Memorial Day weekend. We have other holidays that are coming up. Just remember, if you can, avoid large gatherings, avoid parties, because this is where we know the spike can occur and we can have cluster outbreaks. We've seen the evidence of that already in some other states where people have engaged in party activity and they've been involved with social gatherings. And we're asking people to just hold off on those things. Try to stay at least 6 feet away from the person in your vicinity or in your area. When you're going out, as things open up, as the gyms open up, when churches open up, these are things that we still would like our community to practice. Make sure that as much as you can in the businesses and in these retail organizations and our churches that you can make your organization comply with the social distancing, with the 6 feet of distancing between individuals that are not family members. And especially if you're not going to have a mask on, you want to make sure that you maintain that. We do and have heard, I've gotten emails, I've gotten calls about the mask, and people have concerns about this ordinance of wearing masks. We're asking again, if the majority of our population can do this, it helps those who are most vulnerable, and those, as we see, who have medical conditions that cannot wear a mask, it helps to protect them. So what type of enforcement goes along with this ordinance? We're going to have someone from Nashua Police talk about what their role will be, because we do want for the ordinance to be adhered to. We are going to make sure that we spend time doing as much education around this issue and help people understand the importance of wearing the mask. And so at this time, I'm going to step away from the podium, and I'm going to invite our Nashua PD to come and talk about their role.
Good afternoon, everyone. My name is Craig Allard. I'm a captain with the Nashua Police Department, and I've been asked just to come speak about the police department's role in enforcing the mask ordinance. I can tell you, I echo what the mayor and what Director Bagley had mentioned. It's a partnership with the community. Our goal with public health and with the mayor's office and with the Board of Aldermen is education, education, education. We had a few calls for service regarding the mask ordinance since it's been passed. I think we've had about 5. Of those 5 that we've gotten calls for, 3 ultimately ended up being unfounded, meaning we got there and customers or businesses were in compliance at the time when we were there. And then 2, we did find some non-compliance, and what we did with those situations is we simply did what Director Bagley had mentioned. It was education. Our goal is not for this to be a punitive thing, but an educational piece, and that's our ultimate goal. That's what's being told to the officers as they go onto the street, and that's been part of my job as kind of like the liaison with public health for the police department. That's been my message to the officers on the street, is voluntary compliance with the ordinance, and our goal is to educate and make sure that we protect the vulnerable people as well. When it comes to enforcement of this, it's a city ordinance, so it's a violation. I know there were some concerns early on with fines, et cetera, associated with it. Yes, a violation is a fine up to $1,000, but that's not always the case. Obviously, our goal to get through this pandemic is to issue 0 summonses and be able to have voluntary compliance across the board. That's best case scenario. But in the unfortunate circumstance that we do have to issue a summons for failure to comply with the city ordinance, it's a summons. You would get a court date and you would appear before a judge, and the judge, you could plead your case, and then the judge would ultimately determine the fine unless the judge shows otherwise. So that's how that side of it would work. But again, I'm going to echo back to our goal is education on these calls. Our last resort hopefully would be an issue of issuing a city ordinance violation summons. So that's ultimately where we stand, and with the mayor's office and with public health is, kind of being another arm of education out in the field and out dealing with the public at the retail establishments, at the restaurants, et cetera. We're making sure that our officers are well versed with the governor's orders. There is obviously some crossover with the governor's executive order and our mask ordinance when it comes to retail establishments and what they're required to do for their employees and what they're required to do as employers. And we as a police department are responsible for that as well. We do have a call for service that we've created since the governor has created Stay-at-Home 2.0. So we are able to kind of track that and see what that looks like and kind of how we're responding and what we're getting for voluntary compliance and things like that. So ultimately, that's our goal, is education, education, education. Officers know what the city ordinance covers and what the governor's Stay-at-Home 2.0 covers when it comes to the reopening of New Hampshire and how that applies to retail and restaurants in public places. So with that, I'll turn it back over to the mayor for.
So I wanted to tell you a little bit about what we're doing to help our small businesses, help us reopen the economy. But still on the masks, we all go through denial with this. It's not easy. We bargain with ourselves a little bit. Do I really have to wear this? I don't need to wear it. I might not need it. But these thoughts that run through all of our minds are not true. These protect you and protect other people, help to contain the spread of the virus. We know that this is a difficult time. Many people are a little bit down and are seeking help for that. It is a difficult time, but we still need to be careful and take this step by step as we return to some form of normality. So I wanted to show you some of the things that are happening in terms of our small businesses. Last week, we after approval by the Board of Aldermen, we closed the 2 curbside lanes of Main Street, one northbound, one southbound, to expand the area where the restaurants can offer live outdoor dining, outdoor tables. And this is in part because the governor's order does not yet allow anybody to eat inside a restaurant, but has authorized outdoor dining. And by doing this, we've expanded greatly the amount of outdoor seating. We have many times what we had before. This has gone very well. There have been a lot of customers downtown. This has been going on since last Friday, so this is about the 5th day. We've seen a lot more customers. Our small businesses and our employees are very positive about the whole thing. And really the traffic has not presented any significant problems, any significant congestion. At times it's a little congested, but it was that way before anyway. So far we regard this as a success, but we're still evaluating it day by day. We want our small businesses to recover, and this is part of our effort to make that possible. In addition to that, we have a COVID-19 impact fund. We've assembled some sources of federal money to help with loans and grants to small businesses, loans to small businesses, grants to nonprofits, to keep them on their feet as we move forward in trying again to return to some form of normality. We know we will never be totally back to life before COVID-19, but I'm optimistic that if we work together, if we continue to do this important job that we're committed to together, we can contain the spread of the virus and at the same time return our community to a stronger economic footing than we have when all the businesses are closed. So I'm optimistic. We don't know how long the recovery will take, but I'm optimistic that in the end we will achieve that, and therefore I look forward to working with everyone else in the community to ensure that we meet these dual objectives, helping to keep people safe and also reopening our small businesses, our businesses in general, reopening our economy. So with that, our press conference or our information session is concluded. We do have, we can take questions from members of the press if they have anything, so I will remain here and see if there are any questions. No questions this time, so we will be back next week with a further update, and please be well. Thank you.